The following is a presentation on ADHD and OHI. ADHD is defined by the American Psychiatric Association as a neurodevelopmental disorder portrayed as a persistent pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning or development. It is known as a neurological disorder. Kids usually inherit this disease from parents, therefore they're born with it. 1 in 3 kids who have ADHD usually have a parent or relative who does also. Some environmental factors that contribute to ADHD are smoking, alcohol abuse, illicit drug use, lead poisoning, complication of birth, low birth weight, and prematurity. Characteristics associated with ADHD are varied and usually show up early in child's life. There are 3 categories of ADHD. The first one being is inattention. Some characteristics of inattention is being distracted, shifts conversations quickly, procrastinator, disorganized, forgetful, doesn't complete tasks that are asked of them. The other 2 categories are hyperactivity and impulsivity. Hyperactivity, kids tend to fidget, talk incessantly, have a need of running or walking a lot, difficulty with being quiet or doing quiet tasks. Impulsivity, they tend to be impatient, interrupt frequently, can't wait for their own turn, and converse at inappropriate times. Social and emotional issues are difficulties making friends and maintaining appropriate relationships with peers, diminished self-confidence and low self-esteem, isolation and rejection. Some individuals may exhibit aggression and antisocial behavior. Depression and anxiety are also typical. Children with ADHD may also have learning disabilities. According to CDC, 5% of children in the United States have ADHD. Approximately 11% of children aged 4 to 17 have been diagnosed with ADHD in 2011. ADHD diagnosis is on the rise, and boys are more likely to have it than girls. In 1902, Dr. George Still identified students that were average or above average intelligence with impulsive behavior and inattention as having defective moral conduct. There was speculation on if there was a heredity foundation and if there were any neurological impairments. After Dr. Still, in the late 1930s, it was discovered that administering stimulant medication to individuals with characteristics similar to those described by Dr. Still decades earlier had a calming effect on their behavior. In the 1940s, German scientists Heinz Warner and Alfred Strauss studied institutionalized children with brain injuries and intellectual disabilities because they were exhibiting signs of hyperactivity and distractibility. They found that children with brain injuries who were easily distracted and hyperactive were having negative outcomes on their cognitive performance. These children were diagnosed with Strauss syndrome. In the 1950s, a team led by scientist Cruikshank took what Warner and Strauss did and completed a very similar experiment, only this time the children didn't have brain injuries but cerebral palsy. These children were vastly different than the previous study because they exhibited mostly normal intellectual abilities as opposed to very low ability levels of those students in previous studies. The team found hyperactivity and inattention in children without intellectual disabilities. This established a solid link between attention difficulties and issues with learning. Students with these symptoms were now referred to as children with minimal brain injury, and later in the 60s as hyperactive child syndrome. Not until the 1980s the name changed to ADHD. Instructional modification for students with ADHD are: place students in the least distracting location in the classroom, surround the student with good role models, maintain a low pupil-teacher ratio, avoid unnecessary change in the schedule and monitor transitions, maintain eye contact when giving verbal instructions, make directions clear, concise, and simple. Also, combine visual tactical cues with verbal instructions, make lists and study guides, adapt worksheets, Break assignments into small chunks, provide immediate feedback on each assignment, and allow extra time if needed. Alternate sitting with standing, and activities that require moving around, active participation. Use learning aids such as computers and calculators. Some students diagnosed with ADHD may only need a 504 plan, not an IEP. There are two main types of behavioral strategies associated with ADHD: functional behavior assessment and self-regulation. Functional behavior assessment serves as a first step in determining what behaviors are unacceptable in the classroom through monitoring, observing, and analyzing the situation. Interventions and goals are set in place once this research strategy is complete. The other strategy, self-regulation, is completely done on the student's end. They are to stop, think about their actions, behavior, decide if what they're doing is appropriate, record their findings, and receive reinforcement. This is done with 5 sequential steps: self-observation, self-assessment, self-recording, self-determination of reinforcement, and finally, self-administration of reinforcement. Medications can be used for people with ADHD, but always in collaboration with the educational and behavioral interventions set in place by a school. It is not an end-all type of solution. Teachers are never allowed to tell parents that their child should be on medication. That decision is solely on a medical professional's hand. Most people with ADHD never outgrow having ADHD and have to carry it around with them throughout their lives. Most symptoms do not become more subtle over time, but any academic issue a person had as a child will most likely occur when they are an adult as well. Adults can struggle with relationship, anger management, restlessness, focus on tasks, and job security. Other health impairments. OHI means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to educational environment. It is due to chronic or acute health problems such as asthma, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, and sickle cell anemia, and adversely affect the child's educational performance.